we're going to go ahead and move on now to our next presentation, Dr. Gary Gordon. And I think I'm correct in saying that Gary needs no introduction. I hope all of you know Gary. You know, in the great tradition of medical mavericks, here we have one in our midst. And I'm very pleased that Gary has consented to speak about stemming the tide of cancer. He goes to more conferences than I think I've been years I've been alive, but he really has his hand on the pulse of what's going on in the alternative movement, the nutritional movement, all the various homeopathic, all the various movements that are afoot now, helping us find a better way to deal with this scourge of cancer. And so it's my great pleasure to welcome Dr. Gary Gordon. I'll get you set up.
You know, in this room, we have the power to save our great country because it is these healthcare costs that are making us unable to compete. And if you look at the big picture, you would think that we've set us up for failure because we have contributed to our health crisis with these little tiny problems of fluoridating the water, genetically modifying the food, devitalizing the soil, poisoning all the food that we give with insecticides and pesticides, and then vaccinating our unsuspecting patients. And so in this room, if we realize that our economic system is being very seriously threatened, an average worker and making a car in this country gets paid $33 an hour. If you are in Mexico, they get paid $7 an hour. If you're in China, they get paid $4 an hour. If you get paid in India to make a good car, it's $1 an hour. So I'm very concerned that we have to get our act together. And the picture that I'm going to try to give to you in the next 55 minutes is to give you an overview that attending a lot of conferences, I get a lot of ideas. And in the fact that we do have a chance to do question and answer in a panel later, I must say that I'll go over some of these slides much too fast, but they will all be on my website, and the soundtrack and all the slides, any of you wanting to go there. And I will have a full video of it, a 90-minute slower version than we're going to do today. First one is, your patients always think that maybe if they went to Germany, they'd do better than being stuck with you. So the thing is that this is just a website. It's called Max Awareness, and it's just one of many things we're going to go through rapidly. Any patient can know up to date what they would have gotten in any of the leading centers in the world, because this one guy went to every clinic, talked to the patients, videoed the thing, and talked to the director. This is just to have the president's cancer report actually telling the president that it's got something to do with the environmental exposures that we're all dealing with. So it's nice for you to know there's solid data so that when you see my bias, which happens to be in the area of detoxification, since I'm 75 years young now and I'm feeling far better than I did 15, 20, 30 years ago, I'm looking forward to the future. But I admit that what I take, very few people could afford to take. I put it on my website because I've really suffered for the first 30 years of my life with lots of health problems. But this is the executive summary from the executive summary of this cancer panel, and it ties it together where I am taking it in my mind. If we're going to change the soil in our patient, we need to alert them to what is going on. Now, there's a big movement right now in the world. A lot of people are just simply giving up and taking both breasts off. And now the treatment a month ago was if you have BRCA1 and BRCA2, maybe take the 2 ovaries out and the 2 breasts. And so it's pretty shocking, but that seems to be something that's very popular here in this country. It's not that popular in Europe. But it's, again, lack of good information. So we are all surrounded by tons of information, but I saved this CNN special by Sanjay Gupta when he proved to you how much vinyl chloride is in the air, and the companies that are doing this absolutely deny anything. And every family he visited in Mossville has everyone in the family dying of cancer, and the government does nothing. So you have been too busy to catch this, and because CNN can't afford to play it every night, because this way they'd have no advertisers, because they told the truth. So the bottom line is, please know that I saved saved these things. They're on my website, and anything I have, my job is to share it with you. So please know that if you see something on my website, you say, I want that on my site, contact us. We'll figure out a way to get it. It's not too hard to figure out which states have the pollution. It's heavily talked about. This was one part of Sanjay Gupta. This was part 2. The first part was more about Mossville and the cancer. The part 2 was more about just how toxic the baby is when the baby's born. And if you haven't seen 10 Americans, which requires you to go to my website or go to Google and put in the word 10 Americans, and you will see what $15,000 of testing per baby, taking about 20 tubes of blood, so we took the whole cord blood, 10 babies selected at random one morning in America. And when you see the data, you will understand that you, if you have a loved one that's pregnant now, if you don't do something about having that loved one both not just get the right nutrition, and by the way, the folic acid multiple is not the right one, you know that. The really one, it's got to be the natural, not the synthetic, but you've got to have them on something. If they're afraid of oral chelation, give them zeolite, give them fiber, give them high-dose C, but remember that this will show you. You put in that word in Google, and that average of those children, when we tested 430 different chemicals, is that there was every child had over 230 different chemicals that would be neurotoxic, endocrine disruptors, and carcinogens. And the average baby is 6 times what the parent was, because the body sees the baby as a tumor. So all rapidly growing tissues concentrate these things that I'm upset about. So the Environmental Working Group found the 134 chemicals that will cause cancer, the hormone disruptors, the immune system. And so is it any wonder that 1 out of 4 children in today reporting to school is on treatment for either obsessive compulsive or their brain tumor or their diabetes or their obesity or their autism? Is it any surprise? And how can there be a drug that's going to cure a problem that starts with this problem? Autism now 1 in 100. And we're getting tremendous success when you take my multifactorial approach, which I hope to have everyone see why I coined the term fight for your health. Because the F is for food, the I for infection, G for genetics, H is for heavy metals and hormone, and T for toxin. And because of Brad Week's great talk, we have to make my F not be just food. Let's also include focus, positive focus, people who expect to get well. So obviously you can broaden, but the idea is that we have to realize that everything is multifactorial. This is just a newspaper, USA, just this week. It's nice that some papers are beginning to alert the public, but they don't see it until you put it all in front of them, so that the talk I'm giving to you, I gave to the Nevada Integrative and Homeopathic Medical Association a couple weeks ago, and the entire 90 minutes was videotaped, and it'll be on my website, so you can just play it or tell people to watch it. But the point is that Ralph Moss is doing a good job of trying to tell you the truth. He's I've known Ralph all these years. He was an information officer at Sloan Kettering. He's a PhD. And when he was at Sloan Kettering, his job was to tell people that there's nothing to this Laetrile. But he was having lunch with Sugiura, and Sugiura was their most renowned researcher, and he was telling him how all metastases stopped when he gave Laetrile to the animals. But his job, Ralph Moss, was to tell the public there's nothing to this Laetrile, don't waste your time and money. So Ralph has been seen, he knows what the truth is, so he is a really good resource when you want to know people who know more about the problem. The Time magazine, they're kind of beginning to be on our side. We're all worried about the Gulf of Mexico, and believe me, there's a lot to look at with that dispersant that we added to the oil. It's not going to be as simple as they're going to try to whitewash it, but you don't need to add that to your knowledge base, because we already have enough to make anybody who watches the 2 one-hour specials from CNN that are on my website that you can have. You don't need more to get your patient wanting to do something to detox. Now, if you take the guys that were at the Twin Towers when they went down, and all of those people, if we took the toughest cases of environmental pollution, we took those workers that were at 9/11 exposed, many of them we've had to have not just 1 month of the Hubbard therapy at 10 hours a day, nonstop for 30, we went to 60 days and then 90 days. So do the numbers. If I have somebody going 7 days a week, 10 hours a day, that's a lot of hours of sweating. And if I do it for 3 months, so I'm just trying to put it in your mind that it's not surprising that I do everything every day to take care of my body because I had so many years of ill health that I'm looking forward to what it's like to live in a body that's clean. And it's not what most of us are getting. So the Time magazine is actually saying, amazingly enough, they said we've looked at it, and our verdict is it's worth your time to buy these foods organically. This is just a month ago. The story is changing when you get mainstream media actually telling the truth, when their advertisers are obviously not going to be happy with what is said. And you all know about the fructose story and the there isn't anybody in this country that hasn't been getting up to date, I hope, but your patients still don't know how dangerous the high fructose corn syrup is. They're going to change the name now so that the poor public won't know that they're still getting poisoned. You may know there's been about a 600% increase in lung cancer in women, and many of these women don't even live with a smoker, and they've never been around smoke, and they've never smoked. We do know that it was interesting, now that they're going to try to give us genetically modified salmon, that at least one judge actually paid attention. And he says, I don't think we're ready to have the modified sugar beets with GMO yet, so there's a war going on. So you have Discover magazine saying that one guy, Paul Ewald, says that 4/5 of cancer are going to be due to infections. So that's why when you go to my website and hear my FIGHT program, it may help some of your patients who will deal with things on a multifactorial level. Because remember, I have a lot of world-famous people come to me with their child that won't speak, and they just say, get all the mercury out and my kid will be fine. I say it's never that simple. If I take all the mercury out, that's only the beginning of the fight. So I have to broaden everyone's focus to the FIGHT, which is an easy way to try to broaden their thinking so that they'll pay attention to the fact that the kid's getting foods that don't agree with us and need food supplements that can help us in these infections, which are ubiquitous. If you're not hearing about XMRV, we'll get into it in a slide, but it's the second AIDS. It's being shown in every prostate cancer today, and it's in everybody with chronic fatigue. So if you don't know the name of infections, because you haven't really had the training, because you don't go to those kind of conferences, try to understand that Harvard simply stated everybody has cytomegalic virus, and it's not innocuous. It's causing problem in your body. It's leading to hypertension. It's growing in your plaque. And CMV is just part of the herpes family. So I don't care if you remember chlamydia or cytomegalic or if you want to get into candida, it's anything. You've got to broaden your thinking because we have some cases of colon cancer that go away when you give diflucan. And the colon cancer goes away. So this whole story about infection is a big one. And so there's lots of data out there. And a viral cause for prostate cancer is really hot topic. If you're not reading about it, XMRV, you're going to hear people saying, oh, no, it's not real. CDC will tell you it is real. Nobody wants to talk about it because it appears to be a new form of AIDS. So when you put it and add it to chronic fatigue syndrome, you begin to realize that my concept of FIGHT isn't too bad. Problem is, what are you going to do about it? Because really, I'm glad that ACAM, that I co-founded 38 years ago, is enlightened enough now to let Bob Rowan and I and others teach oxidative medicine occasionally, and we'll do a course in Minneapolis in spring on oxidative. But you can't learn it all in minutes. I mean, I go to every meeting on continents around the world. I've been to all the meetings on ozone. There isn't anybody in Germany or Russia that wouldn't be offering you ozone with ultraviolet blood irradiation. And there's no question you can drop the titer to Hep C or to AIDS 30, 40, 50, 60%, and a few treatments, 90% by the time you do enough treatment. So now what can I do? I can't get everybody in every state to be comfortable with that. So vitamin C is a pretty good backup. I mean, Hugh Ridden laid it out how much of a drop he could see in very serious cases of hepatitis, but sometimes it was 100 or 200 grams. But he gave us all that, and I recorded his stuff, and if you don't have, we still have his talk somewhere on one of the things, and all the details that we've got to honor those who've been before us, because there's so much to it. I've been able to add to it by finding an actual silver that's real. I didn't put my name to any silver until somebody had data. And I didn't believe it until I went to BYU and saw Dr. Robinson, the director of the Level 3 Research Lab, where he has things like Ebola. And he's done enough studies now that between he and Dr. Gerber at the University of Arizona, this company that makes this silver actually has the only approval by EPA as a sporicidal disinfectant. That's big words. They will have a special one just for anthrax spores, but they have to give you a little details on how to handle it. But it means we'll never have to close down our nation's capital again because of somebody mailing anthrax. So you need to know that there can be differences. And just because somebody is too busy, take your time, because the research documents that the average, including Lyme takes about 8 minutes. It's kind of slow. Everything else takes 2 to 3 minutes. When we compare it with other silvers that I never endorsed, we find them taking anywhere from 8 hours to 24 hours to get the same candida lowering effect. So across the board, silver is a big story. And what was really fun in silver is that if you read up on it, those of us who want to go to outer space, if you want to do and make rocket fuel in your backyard, the way you do it is you get hydrogen peroxide and add silver. What I'm telling you is they're both pro-oxidant. And you can see that if you have ever used peroxide in your ear, it kind of bubbles gently. Put a little of the silver on top and it kind of roars, because it's kind of telling you where we're going. I am not doing a Fenton, but we're in that area. So the point being that silver in tiny doses, so there's lots of researches, but since my big thrust is zeolite, it's nice to know that 99% of my colleagues really don't know how to spell Z-E-O-L-I-T-E. They can't imagine that it's an aluminum. Well, if it's aluminum that's just giving the patient aluminum, why would you give it? Well, this is just off the Memorial Sloan Kettering website. They're just trying to tell their people that it is being thought about in anti-cancer. Well, in Europe, in Croatia, where they have really researched zeolite, the Croatian government has put this money up to study zeolite. And they have one of the studies that's going on at Harvard, and it's in the area of immune enhancement. Because think about it. Zeolite has got millions of little cages. It's like a sponge. Now, you know, it's just volcanic material that goes up and comes down. Where it comes down will detect a lot of what's going to happen. It could come near water. It could fall in a polluted area, which you couldn't use. There's 40 different kinds of zeolite. So when you get through all those little ifs, ands, and buts, you'll understand that zeolite's been used historically, and it stops diarrhea, and it's an antioxidant and immune enhancer. There's a lot of interesting stuff about it, but I have a whole website because it's complex enough. I don't want to put my name, since I kind of felt as the co-founder of ACAM 38 years ago, I felt I have a little bit of credibility in the area of detoxification, and I wasn't about to put my name to zeolite when I've defended oral chelation for years, and I'll be handing out some papers which you can get up here at the front that make sure you understand why I like the oral chelation. Not just because on my website there's 507 published references on oral EDTA, which none of you knew about. And it actually is the only way you could run a lead battery factory. How could you have people working with lead if you didn't treat them every day? But it goes beyond that into treatment of cirrhosis and other things that you don't know anything about. But the reason I'm in favor of it, and the reason I mentioned earlier David Berg's ability to get rid of his prostate cancer with heparin, was because EDTA makes heparin work by mouth, which has been the magic that's allowed me to cancel bypass surgery on all patients for over 20 years, even if they're 90% blocked LAD, and even if they have 1 million followers. I have some pretty famous patients. But I tell them, since I don't have anybody dying of a heart attack, there might be something here to what we're doing. And I think what we're doing is affecting blood coagulation, because that was what Lester Morrison did. So I'll be giving you an article. On the back of the article are 3 books that he wrote explaining the heparin, the mucopolysaccharide, where we found a heparin-like material in the ocean, and how I worked with him and added to that EDTA to get an oral product that seems to favorably influence blood coagulability and viscosity, so that I enhance circulation to a cold foot. Because think of it, if you're working around right now on tomato ketchup, and I switch you over to wine, you're going to have a lot more circulation, even if you're badly blocked, because it's going to be a lot less difficult keeping, and your heart is happy with the less work. But zeolite traps, nullify. This is the big thing. You can't imagine if you're a chicken farmer or a hog farmer, your neighbors suddenly are willing to talk to you. How come? There's no ammonia smell to your chicken or hog farm the minute you start doing the zeolite. Now, zeolite can be cheap and used as cat litter for $10 a ton, or it can be a very special textbook that you can get on my website. It's called Handbook of Chelation, Handbook of Zeolite's Research. And they have in that the fact that you can spend $20,000 for a kilogram if you're going to have the ultimate filter material, which can be really a very powerful filter, and that's what you have to have if you're going to travel to Mars. Because if you go to Mars, you're going to have to be recirculating your own urine and sweat, and it's what you're going to be drinking. So you'd like to have a pretty good filter, I think. And so just a thought. So anyhow, that's why there's a lot of things about zeolite reducing cancer risk. My friends in Dr. Robert Trussell happens to be treating the director of the research in Croatia, who developed the advanced material there that I almost brought to America until I found something that really exceeded what they were doing considerably. And so what they're doing, they have some cancer patients, and pancreatic and colon cancer, they give a teaspoon every hour for 16 hours a day. Think about it. If you've used that much of a trapping material, that clearly, when you look at the research, picks up not just the metals, but also deals with many organics. But in a sense, your Peyer's patches think they have the day off, and the liver has the entire day off because there's no toxins, because you've neutralized everything. I haven't got all the lead and mercury out of you, but over time, we're getting pretty good results on autism and Alzheimer's. We're getting pretty good with the stuff. So anyhow, what we did is we just added the silver, because what I found is that I have these patients that come to me who've been to ACAM doctors that I felt should be competent, but they sit there and tell the patient there's no mercury coming out of your kid, just take him back to occupational therapy, we can't help your child. Makes me mad, because I've lectured now for several years and shown the data that just because they don't get mercury out of the kid doesn't mean the mercury's not there. I mean, if you go to any of the meetings I've got, after all, I was the co-developer of Mineral Lab. I sold it to Doctors Data. I put on conferences on minerals around the world for all these years. You can't live on this planet and not have the average 1,000 times too much lead that's in the bone of every child born on the planet. So don't tell me there's no lead in your patient. Just that you don't know how to measure it. And I've been really teaching everybody that at Harvard Medical School they have the beautiful, non-invasive ability to tell you how much lead is in bones. And they've published these papers. And there is no safe level of lead, and they have all the documentation. The level of lead in your bone determines how soon you go blind. And the level of lead in your bone tells you how soon you're going to die of a heart attack. So it's all published, and you don't get any of the lead out of your bone with IV EDTA. It doesn't move the bone. Which is why anybody who comes to me and I take him, say he's been a welder, and he's been welding for years, and you feel really good because you know you're going to make him well. And you give him 30, 40, 50, 60, 70 chelations, and finally nothing more is coming out, and he feels great. And you send him back, but you don't put him to work because you figure, well, maybe he's one of these people, because if you read the book by Hightower, Diagnosis Mercury, we had her speak at ACAM. Some people get rid of the mercury you get when you eat your fish tonight in 40 days, and some people take 160 days. So we have this genetic variation. But when you look at the person that you've just taken all that lead out, you haven't helped him, because if you just send him back, but you make him work in a sterile environment, he never welding again. But 6 months later, he comes back and you do a provocative, it looks 90% as bad as the first day before you gave him the last 100 chelation. So you have to learn that you're going to have him on continuous detoxification for life so that he doesn't continue to add to his bone stores. And that's why women, when they go through the change of life, they all develop the hypertension, because they're releasing the lead from the bones. So it seems that people aren't putting all these pieces together yet, and it's really a simple story. This is the approval that the people who make the silver got. It's now called Steriplex, and that doesn't mean anything to you at the moment. But I listen every day to Dr. Radio, and Dr. Radio is NYU Medical Center. So I now, because I listen every day to the heads of department of a medical school, every department from neonatology to reproductive to plastic surgery. And the plastic surgery guy says, yeah, about 15% of women we put these implants into, it turns into a really severe reaction, becomes a rock. And it's painful, and they're pretty unhappy, but we didn't really warn them. But we think it's infection. And he said, but there's one guy down in Houston who's really figured out how to reduce. And he said only 2% of women have this terrible capsular reaction to their breast implant, because he's really taken the time to do super sterile. But no one's going to do super sterile. So someday you'll want to all learn a lot more about this, because you won't want to see a dentist that doesn't have this in his office, because you're going to want to learn much more about where infections, how we're going to deal with them. So the cancer chemotherapy, curtailing its use politically. Marcus Cohen writes regularly in Townsend Newsletter, and he's not tongue-in-cheek. And so he's got some pretty thing. He said it's not too cynical to say it, but it's been suggested by some that the major beneficiary of the off-label use of chemotherapy is the appointment book of the oncologist. What he's trying to say is that since most of the chemo being done is not for approved indications, and if they do a study, and if there were two equally unproven treatments, and one was available orally and he doesn't make any money, and the other he gets filthy rich on and makes $50,000, you know which one's being given. And he's calling for an investigation of this, but it's going to be hard to stop it. So he does a good job of saying there'll be very few trials of nutrients. We know what the answer is. We have answers. We, in this room, those of us practicing, do know that we can actually change the life of many patients. We don't have to claim to cure every cancer, but we can do things to stem the tide. Now, it's interesting that Gina Kolata, who I used to think for a period of time New York Times was out to put us all in jail, she actually now seems to be on our side, and she's just saying the failed war on cancer, and she's rubbing it to these guys, and she's pushing it down them. I mean, she even writes articles about how could you keep on doing bypass surgery with so little data to show any improvement over none. I mean, so sometimes there's some great articles, and I send all of these articles to anybody who goes to my website, Gordon Research, and joins my advanced school of medicine, which is called FACT, Forum on Anti-Aging and Chelation. There's no charge, but you have to join. When you join, you'll get a password. When you have a password, you'll get 3 updates from me every day of the year. You don't ever have to read them. But that's how I build the database, so that when you want to know what I'm doing with autism or breast cancer, you can put in the word and you have your password, and you can see what and then we have 2,600 doctors, many of whom choose to contribute. So by simply joining FACT, a lot of you can learn, because I send out things that I think will be relevant to many of you wanting to put on the bulletin board in your office and getting your office staff telling your patients about these things. This was an expose very recently in the last month about what it's really costing. Provenge is going to cost $93,000 a year and add 4 months to survival. That's the kind of stuff that Gina Kolata is exposing these guys, with an average of 2-week increase on many of patients being given chemo who are spending $50,000 and $100,000. And like this patient says, he said, it's the last thing, he said, I wouldn't spend that money if it was my money, because he knew that this was just a sucker game. But since it's free of charge, the taxpayer is going to pay for it, let's go ahead and give me the treatment. It's so sad. These are the costs that you're spending. Provenge, you might extends life 16 weeks. Herceptin, $2,000 a month, you might extend to life 11. Tarsen, pancreatic cancer, $4,000 a month. You might live 12 days later. Erbitux, you might spend $300 to $800,000 for stuff that is not doing anything, but they're supposed to be the mainstream. So our problem is people are being brainwashed. This is the month. This is breast cancer month. And are we all going to be in favor of mammograms, or are we going to learn the truth? Mammograms, the best study that they released, and it's in one of these slides, is showing that if you did 1,000 women for 10 years, yearly mammograms, you might have saved one patient's life. Do you know how much distress you've done to those other women? Do you have any idea how much meddlesome, bad medicine is going on? And they admit it may be prone to error. It may not have even been a 1% increase. Now then you get into this thing, and the way they wrote it up, they tried to tell you that about 93,000 women have been treated, including breast removal and radiation, for what now is seen to be not cancer. In other words, when we talk about ductal carcinoma in situ, we're really talking precancer. And so they're really trying to get the word out, because so many doctors are getting used to a high level of living. Really, just like for a while, every poor guy was getting biopsied on his prostate every year. I hear them call in when they've been biopsied 8 times in a row. I mean, they turn this into a sad game. So what I try to do with the doctors, there's 2,600 members of my advanced school. I try to give you a different perspective because I listen to Doctor Radio, which is in anybody's car or on your computer. You simply join Sirius or XM, FM, and you join, and they are on 24/7. So day or night, you can hear the latest lecture, and it's updated each week. And the things that you hear, because the public calls in and says, gee, I've had 7 operations on my back, and I'm still in agony. And the head of neurosurgery says, I haven't seen a back case I couldn't make much worse by operating. And so you have some honest things come out being said by honest people, but they don't know what we do. And we know this. And so if there's a way of us combining what we know and getting the patients of this country to learn, because they have all this obsessive compulsive and this depression, and no one is ever asking them how much fish are they eating, how many fillings do you have in your mouth. There's no tying anything together to how much D is going in people. It's just so sad. And so what we're trying to make it very clear is DCIS has been so unnecessary, the radiation, the drugs, and the fear they put these people through. So I hope that I have inveigled some of you to become interested in thermography. Thermography, I was one of the first to buy an AGA thermograph for $56,000 40 plus years ago. And I've lectured around the world on thermography, and it's such a simple process. When you see a hot spot on a breast, it's a much more reliable spot than just trying to read some crazy thing on a mammogram. And the nice thing is that you can then take now you have a patient that might have a problem or could develop one, and now you're in a position that you can show some of the blood tests that I will get into here that will differentiate who needs to do more and who doesn't need to do more. And or you can do simple things. There are people now simply using very simple topical treatment. Some people just put iodine on the breast and take it orally for a few days and things quiet down. You see all kinds of interesting opportunities. And the patients have no idea how lethal these CAT scans are and how much radiation they're getting and how clearly even mammograms over a 10-year period are significantly taking some women into much higher levels of cancer. This is just to remind that there's beautiful pictures on the website these days of what tumors really look like that are sometimes educational. Lancet is trying to make the PSA test. When I'm listening to Dr. Radio, they have the guy who invented PSA tests say, I never thought this was a cancer screening test. I always thought it was a test for infection of the prostate. And so they have lengthy discussions. Now, there is one study out that would tend to tell you that PSA still has some potential when used properly, which is a lot different than the abusive way it's being largely used now. And you can wind up doing some useful things with the test. What we want to teach people about is get the word epigenetics clear, because if you say to somebody with my FIGHT, well, how could we have an epidemic of autism if it has a genetic component? Very simple. We have Randy Jirtle at Duke University. His work has been picked up by PBS and Nova has done a special called Ghost in Your Genes. And they try to explain to you how a single exposure to bisphenol A, you've all been hearing about bisphenol, the plastic hardener. Single exposure takes the lean, brown, agouti mice and makes an overnight change in their methylation capability, an epigenetic change, that all of their offspring henceforth are all obese and diabetic. And the color changes to yellow from brown. Now you will learn that you can overcome that when you really learn methylation support, which is why when I give vitamin C, I always add trimethylglycine and methylsulfonaphthane. And that's why when I give anybody on any treatment, I always have them on sublingual methylcobalamin along with a 5' methyl tetrahydrofolate. The tetrahydrofolate is the natural form of folic acid. That's the real one. So I'm really into this whole thing of epigenetic change, and there's a lot to learn. Jeff Bland did an incredible job in the first talk that he gave at the Institute for Functional Medicine meeting about 3 months ago, when he tied together with this talk, which he broadcast over the air, and it is on my website, and really is so brilliant is he's got some graphics that are to die for, these graphics. And he was explaining to you how aging, cancer, and heart disease are all the same molecular mechanisms. So if we then look at Dr. Kobayashi, I was spending for about 9 years, I would go every year to teach and work with doctors in Japan that are interested in alternative methods of treating cancer. And for about 33 of the last 34 years, I've attended the cancer control meeting held every Labor Day in Los Angeles, where we cover the subject cancer. For 33 of those years, I was at that meeting. And in one of the meetings, I've met the people that wound up introducing me to Kobayashi, who's an MD, PhD, molecular biologist, and oncologist pathologist. And so here you've got a guy that's unique, and he's very, very compulsive. So what he did is he got the Sun Moon Church to fund, and the members of the church each year would have a blood test done, cost $500 in Tokyo. And being compulsive, he had to have plus or minus 5% on his CEA and his ferritin. So he can't get what he wants from just any schlock laboratory. And then he spent the time to find out if the ferritin's a little elevated, then a tiny perturbation in CEA is a lot much more persuasive that the patient is moving into cancer. So he developed this entire algorithm. So Kobayashi is the guy that is allowing me to stand up and tell you that he can take anyone, no matter how positive the family cancer history is, and even if they have the gene for gastric carcinoma, BRCA1, BRCA2, they don't have to have the breasts and the ovaries out. They don't have to do all these things. Because you carry the gene doesn't tell you anything. When you get into molecular biology, you'll be able to actually, Ed, would you get a book for me out of the front of that thing? And I want to make sure, there's a guy by the name of Bruce Lipton. And Bruce Lipton has actually been, he was part of the What the Bleep group, and so you'll get to know Bruce better. He wrote The Biology of Belief. And when he ties into your head what these whole molecular signaling is and begin to understand that just to shock you, if I say to you, and I take the brain out of the frog, you say, what happens? The frog's dead. So I take the nucleus out of the cell, what happens? Nothing. The nucleus is not the brain of the cell. The brain of the cell is the membrane. And so when I start to take you into this area that you know nothing about, you'll see why after reading his new book, Spontaneous Evolution, I have now signed up for a course on quantum mechanics. Because I've got to understand this whole idea that everything you thought you knew probably isn't very true. And until you understand how untrue much of what you accept is, like, it's very hard for me until we have this beautiful lecture today about the benefits of using chemo with vitamin C. It's very difficult for me to be in favor of chemo until I'm blasted with facts that I can't ignore. And we're all that way. We have many prejudices that keep many of us from doing as much as we could do. But he has shown that when he took these 10,000 church members, agreed they're probably a little more compliant. And so when the guy's cancer test got a little bit too positive, and he said, another 2 years like this, you'll have a lump or bump somewhere, the guys would actually stop smoking. I mean, so he had a good church group. So maybe his data doesn't apply entirely to everybody, but what he's got is he said that the integral treatment, combining conventional Western treatment, thermal treatment, which is just far infrared sauna, negative ions, which is why I'm going to take you all into energy medicine, which is where you'll wind up if you buy the book, Spontaneous Evolution. You will become much more attuned to everything from microelectric current to pulsed magnetic therapy to hyperthermia to homeopathic and the power of positive thinking. But across the line, he's made the claim that this can cure 70% of his cancer patients, but that's the late stage. That's not where we want to go because, we already know maybe we can do 30%. But what he's trying to do is take and have people never get the lump or bump. And so he's been quite successful at that, and his entire program is really very simple. And if you go to my website, Gordon Research, and you put in the word cancer, on my website, up will come all of his papers, which includes his paper called World Without Cancer. Now, he actually got Ronnie Reagan's blood test to test him. And he actually did a study, which I've tried to bring all of his papers to the National Cancer Institute. I gave them all to leading doctors who are supposed to be very open to our thing. And everybody managed to throw the papers away because no one sees a way they can make any money on this. Because what he showed is that if you make people go to bed a little earlier, lower the stress, simplify the diet, and do some detoxification, use some far infrared sauna when needed, and do some immune support, that without fail, everybody's cancer screening tests, no matter how bad the family history. And remember, in Germany, in Japan, we have a lot of gastric carcinoma. So many people enrolled because they had lots of gastric carcinoma in their family. None of them expressed the disease. That doesn't mean that if you took the stomach out, you wouldn't find those small nidus of cancer, because what is the facts on cancer? Dartmouth Medical School, Dr. Black, did the study 15 years ago. It was published in the New York Times, and I've carried it everywhere till I couldn't even find it anymore. But you put his name in, Dr. Black. He's the one that did the studies on autism, on autopsies, where you take the breast of the lady and you go through the entire breast, slide after slide. Costs a lot of money, but that was showed 38% of all women at age 50 have breast cancer, and about 98% of all thyroids have thyroid cancer at that age. And of course, you knew it was 50% in the men's prostate, so big deal. Because now that we know enough to say that that average patient isn't going to die of his prostate cancer, then obviously the question becomes, how can we separate the tough cases from the non-tough case? And so it was interesting that in his 10-year study, none of them became tough cases, because he took patients who were not diagnosed at this point with active cancer. But he was showing you that these simple things always bring those tests back to normal, because he's trying to explain the average cancer is this 7-year time frame. So right now we have potentially 12 million patients we should be treating. They're called cancer survivors. They're people who've been brainwashed because the well-meaning surgeon tells them, I think I got it all. And I tell him, since cancer is a systemic disease, I don't tend to believe him. Unless he threw your whole body into the biopsy specimen, you didn't get rid of your cancer. So, of course, we do know that some of these have a remarkable, very aggressive tendency. But across the board, these are the tests that he put together when he put his panel. And this guy, remember, I told you, molecular biology and pathology and oncology. So you don't find a lot of people thinking, why would he put in not just the ferritin test, but the sialic acid and RNase and the alkaline phosphatase and the CEA and the tissue plasmid and CA19-9 and the heat-sensitive alkaline phosphate. But he puts this panel together, and he tells you your stage 5, you will have a lump or bump appear in the next year to 2. So his job is just to keep people back in the stage 1, 2. And anybody who was in these ranges always came back doing these simple things. In this way, he had a gradation, and I told him, I've taken him to Paris to lecture. I've introduced him to Emory University. I've taken him around the world because this guy's got the data to prove that no one really needs prophylactic mastectomy. He's got the data. But I told him, you're never going to get rich, because we live in a day in which I'll get to the point I can get your same data out of a single drop of blood, and I will show you that in a second. Recently, we had a lady that didn't do well on her thermograph, and she was too much in a hurry to send her blood way over to Florida, and so she used the mail. And they said the HCG was perfectly normal. Well, the thermograph was upsetting enough to us that we sent that lady's blood down to him, and doing it 2 ways. He's a specialist at ultrasensitive, but only he saved the phosphohexoisomerase, a leading pharmaceutical company. Japan has been over here trying to hassle him to figure out how they can cut a business deal, because they don't know how to do PHI. But this is part of his $371 panel. Now, this is a different panel that's done by molecular methods. It takes virtually 1 drop, and it's in San Diego. It's much newer, so I don't have the clinical experience to validate it, but I can tell you on the Chandel test, this one here, I have Dr. Herbert Pardell, board-certified internist, that in 15 years has never had a patient suddenly develop cancer who had passed this test. That's what got me into this thing, because when I went into anti-aging 38, 39, 40 years ago, I've only practiced medicine 53 years. But when I got into it, I took the mayor's wife, attractive young lady, and she went on my anti-aging program, and we were 6, 9 months into it, and suddenly I'm seeing her with metastatic melanoma. And so I began to realize what a stupid doctor I am, that you don't know what you're treating if you don't have any way of testing people. And since I've visited the clinics, Dieter Hager has been the head of the group that do biological cancer therapies in Germany, where the government pays for biological cancer therapy in Germany. So I've been to his hospitals, and I've seen people that don't look any sicker than anybody in this room who were there because their melanoma had already metastasized. And I can tell you unequivocally that many of those melanomas are not diagnosable by anybody at this point. They didn't even know what part of the skin was the primary, and not all melanomas even have to have black. So we're living in a complicated time. So if you have wealthy clients, which I happen to have, it's nice to cover your butt because it's nice to not be surprised. Now this test is $150, but it's kind of, this is the new one, the molecular one. It's newer, and it's so new I don't have enough data yet on thyroid. Another one, we can brag about how good they are doing on liver. You can see their sensitivity and specificity pretty good on liver, and it's not bad on some of these other. It's not good on prostate at all, so they'll throw a PSA for the $150 they charge. And because you live in a day and age in which this isn't going to have official FDA approval, patients are paying cash. So their websites are very simple. This is called You Test You. The patient deals with them directly. They have a doctor who will explain the results to them. But I'm only looking for what I like is that if I take these 12 million patients who are so-called cancer survivors who've been lied to that because they whacked a part of the patient's breast off or whacked part of the prostate out that they've changed their life, I like to use some of these more sophisticated tests and really have an idea where the patient's at on their overall cancer load so that I can use some of the other tricks that we'll get into. So Dr. Radio, in case you haven't picked it up yet, this is fun. It's Sirius Satellite or XM, and you can have it on your computer for either $2 or $5 a month. And I want one day to start recording it because I hear them say things as the heads of departments of everything from pediatrics to integrative cardiology. Their head of holistic dermatology puts all the patients on probiotics that he sees that have got everything from eczema to asthma. And across the board, he does muscle testing to find out which foods they need to get rid of. So there's some hope for us yet. And their oncology department, the oncology meeting is unparalleled because the two people who put on the oncology section, they'll get 1 week, the head of Sloan Kettering will be the person to interview. And so you have live, and the public is calling in and asking questions. So this is an incredible source of knowing what's going on so that you can keep up. And so this is one of the people they interviewed, is this person who's really done a good job of pointing out that such doctors are pretty loath to ever throw the towel in. And that wonderful picture that Dr. Tom Levy sent to all of us about in New Zealand about the patient they wanted to pull the plug and let him die and wound up getting 100-gram vitamin C. That video is priceless, and I have it on my video. But across the board, it's something your patients need to see because 100-gram vitamin C took a patient who'd been 24 days in coma, and the patient is fully back to driving his tractor, and it was vitamin C that saved his life. But you see some of the power of the story and the resistance to the system. When he started getting well and they transferred him to a regional hospital, they didn't want to let him have vitamin C anymore. The point is that I've put this slide in because when you listen to their people that handle hospice or the people that are intelligently able to deal with the patient that you can't help. Because when we can't help, we're reluctant, and it's hard for us to face a patient that we haven't been able to help. But that's the time they need us the most. So that's the reason I'm trying to tell you there's a lot of learning. I drive a great deal in my car, so I get 10, 15, 20 hours a week of postgraduate medical training by simply turning on my radio. So nutraceutical use in late-stage cancer, there's lots of things. This is Cancer and Metastatic Review. There's sources out there, but you all have your sources. And even the Townsend newsletter popped up for the fact that garlic is good. Vitamin K2 is very good on cancer risk. And we know that across the board, pomegranate is helping people. And all of us know the green tea story, and there's pistachio and there's broccoli, and across the board. But if we look at simple things, curcumin, diindolylmethane, we all know that there's all these things, so we won't dwell very much on those things. I only put them out because when I try to bring Kobayashi's exact blood panel to our country. So we do all that panel I showed you. Leading laboratories like Dr. Vijdani of Immunosciences says, Gary, I'll bring the test over here. He says, I only need to invest $250,000 and I'll be able to do the exact Kobayashi panel. But he says, Gary, you have to stop lecturing about heart disease and switch your lectures to cancer because people aren't going to drive in and ask for a cancer test unless they understand the bigger picture. When they understand what cancer can really cost them, when they understand that it is now only, in some countries, cancer is the leading cause of death today. And he said people won't ask or go along with getting a cancer screening test unless they understand that we can bring these tumor marker tests back to normal. So I'm just saying, we're going to make it happen. This is Dr. Agarwal. I mentioned him earlier. He's at the University of Texas MD Anderson. He's in charge of experimental therapeutics. And his new book will be out with 500 references coming out in the next couple of months. This guy, MD, PhD pharmacologist, he will show you things that makes most of what we are doing still look like we haven't learned enough. And then there's our dear friend, Dr. Abraham Hoffer, without whom I wouldn't be practicing, because Abe Hoffer was one of my mentors who held my hand and got me to see everybody in Northern California with schizophrenia, along with Dr. Linus Pauling and Dr. Shute and Dr. John Miller. The people who changed my life go back, but Abe Hoffer was the best. So this is some of the useful suggestions that he has given us. We know that high-dose C is powerful. We know how this is working. We know that vitamin C is finally getting some of the attention that it deserves, but thank heavens to our researcher today, it's going to go to a whole nother level. And so high-dose story, this is the story that Tom Levy was very involved in making this guy go from this being at the terminal stage to the wonderful story that is validated by New Zealand television. And I introduced chelation to New Zealand years ago. And they don't do to you what CBS 60 Minutes does, which is suck you out, then try to get it off thing, then chop every one of your words around and make you look like you're an idiot and get you locked up by the police. They actually treat you as a gentleman, and it's a totally different thing. It's the best balanced review of what high-dose C could do in a case of somebody whose swine flu had settled into double lobar pneumonia, was facing death. So our patients don't know very much about the adverse drug reactions that are going on. They have no idea that how many people, there's at least 106,000 are dying each year of adverse drug reactions. If people had any idea how little benefit, I mean, it's like the lecture I give all the time. How much proof is there that a vaccine ever helped anything when it was improved sanitation and nutrition that was dropping down the smallpox and the polio? But people don't know that. So they think that even though there's a risk I'll get Guillain-Barré and be in a wheelchair the rest of my life, it's my civic duty to make my children no longer able to have speech, because I wouldn't want to take and expose anybody to measles or mumps, these terribly frightening diseases that we all went through. So anyhow, medical mistakes kill a lot of Americans. This whole thing about bioidentical has really been useful, because in the work that I do, I have been able to come up with some interesting things. Estrogen mimics, of course, we all know that first slide I showed you with 10 Americans showed you the endocrine disruptors, the dioxins and PCBs that are in everybody in this room. No one can pass the test. Any one of you take your blood and send it to Mount Sinai School of Medicine for a lousy $4,900. But if we test your child will be 6 times what you are. And then you'll start to understand why there's this huge disconnect. We have many disconnects. Bruce Lipton is pointing out in Spontaneous Evolution that there's a disconnect, that they can't, in mainstream medicine, they can't deal with the fact that, for example, going back to dogs, the dog always knows when Brad Weeks is coming home. The dog, he doesn't have to call. The dog starts wagging his tail before he even makes it around the block. So we know that there is this field, and the field is what is totally ignored in medicine, which is why those of you that are ready to go to the next level will wind up writing down the word spontaneous evolution and wind up getting a book that I think may change your life, because the guy was a professor at a medical school at the University of Wisconsin, where I'm from, Madison, Wisconsin. And having been at that medical school environment, he could see that there was a waste of his time. And so Bruce Lipton, I have now arranged for a whole new series of video things, and I'm talking to somebody that will take a health news network to the internet, and we're going to have our own voice that will get the word out. So we're working to change things. But the estrogen receptors, ER-positive things, there's a lot of things that we need to hear about, and there's obviously the raging controversy, those who love soy, those who hate soy, and on down the line. And I'm so glad that Dr. Weeks mentioned the Halon, and Walter Wainwright is truly a walking encyclopedia on what those soy that he developed with Halon can do. Estrogen receptors, we're not going to spend a lot of time, but I have to throw a word at you, SERM, so that if I go too fast, selective estrogen receptor modulator, because I'm going to be passing out some papers so that you'll all understand that there are receptors in your bone, in your lung, in your liver, and I'm talking about receptors for these are the beta receptors, and I don't want the alpha receptor because we have too much with the dioxin PCB, so I need to have the SERM beta. Why am I making a big deal out of it? Well, because we have found a substance in northern Thailand where they had the lowest incidence of breast cancer, and that turned out to be Pueraria mirifica, which stood for miracle herb. And we found in northern Thailand that it was part of their diet, and it's taken us 10 years to tease out what was the active part of a large gourd that sometimes had none of the active ingredient, and we've been able to identify it. And I've worked with the Thailand Research Council, and I meet there regularly with MD PhDs, many of whom came from Johns Hopkins. They're extremely well trained, and we have lots of data. And I'll be putting all the research papers up here in the front so that you'll be able to grab some of these papers to learn more about this, because they don't seem to have the men getting up at night to pee. They don't seem to get much Alzheimer's. They don't get many broken bones. And we've actually been able to see that it actually works as good as tamoxifen at inhibiting the proliferation of the common breast cancer cell lines. So finally, I have something that can really protect the woman against the hot flashes, the vaginal dryness, the insomnia, the depression, and at the same time offer a real treatment that is actually protecting the breast. So I'm only throwing this out because a lot of you haven't heard receptors. Unless you get into molecular medicine, receptors were not part of most of our training. I've given a lot of this information to Jonathan because we know estriol is doing a great job, but it has always the potential that they'll take it away because it doesn't have the greatest legal standing. And so I have found something that can do everything that estriol can do. And these are 10 tips that you can do to cut down breast cancer risk. And again, all of these slides are going to be on my website. And we do know that soy taken early in life has some substantial benefits. Well, in northern Thailand, where they have Pueraria as part of the tea, part of the beverage, part of the daily food, they're getting something that's even better than and you don't have to have this fight about who agrees and doesn't agree with the soy. So, second opinion is trying to bring this thing, again, eating a food can cut down cancer, and soy consumption. Now, Pueraria was the interview that Richard Passwater called me up, and this is on my website, and this is part 1 and part 2, and I've got a lot of the references, and Christiane Northrup's new book has done a great job to take the story and say that it was known as Thai kudzu. Now, in America, kudzu is a weed. And there's many different forms of kudzu. Been shown to be effective, very effective at relieving. We have FDA. I've met with the head of FDA over in Thailand. They're very, very supportive. They've always considered it a treatment for menopause. But it treats vaginal dryness, hot flashes, insomnia, irritability. 13 different species are native. Only one is giving you all of the things you want. The standardized effect is a potent plant sterol known as merestrol. Has estrogen-like effects, really estriol-like effects on bone and vaginal while protecting the breast and endometrium from the end. In one study, they compared it to Premarin. Premarin had an estrogenic effect that was similar to Premarin, but without the side effects. So then, if you look at it, there's going to be a bunch of papers that I'll give you so that you've got those. This is somebody saying that they've had good results in lots of people, and we don't see bad things. A Japanese study wanted to find out, well, if you started to really push it into people, what would happen? Would it materially change the body's urine estrogen levels? And before and after, you can see there's no change, so you're not having an estrogen. Yes, yeah. And so we all know the vitamin D story, and so we know dwelling on the vitamin D story. When you get down to it, one clinic, as I mentioned in the first slide, the gentleman in the first slide has gone to every clinic. So he's gone to Dr. Forsyth in Reno, who's got great, and he visited Contreras. And Contreras, it gives you some data. He does pretty well on lung. At the end of the 3-year, he's got 29% survival, and mainstream is about 3% survival. So, at least he's doing a study collecting data. This was the book that none of you have because I worked with Dr. Ransberger, and this book has 800 references about why the Wob enzyme is the real thing. Dr. Levy is to be congratulated on this book, Curing the Incurable. I love the vitamin C. I'm going to hand out at the front, there's going to be these sticks, and the sticks will be the vitamin C sticks so that all of you should test yourself, and all you want to do is be in the yellow color. It's my goal to test and get everybody to understand that if you found from today's talk that a lot of people are going to be in the green color, we would have called that scurvy, but you could make it more sexy and just say that your oxidative load exceeds your antioxidant capacity. But I've got the sticks here to hand out to all of you. This is a great book on herbal. This is a really neat guy who's 17 years surviving his brain cancer. He took standard therapy first. They had him as a guest on the NYU thing, and they all started eating sardines after he's been there. And so anyhow, on my website, the main website is Gordon Research. That's where it's got a little thing. You put in a word, and the stuff I can talk about openly with FDA is there. Like you can put in the word cancer, and it's open Kobayashi's paper. The stuff I can't talk about there, you have to scroll down, and it says, I'm a health professional. You tell me your name. That's all you have to do. And no charge. You never see a bill. And you get 3 emails a day. The other one's Fight for Your Health. And the other one that we have is the Zeolite Answer. And I hope all of you join FACT so we can have further discussions online. And I look forward to the question and answers after our break.